sensation. It's assessing sense. It doesn't have a motor control. Location of cell bodies, the olfactory epithelium. The main action is smell. So important things to know about cranial nerve. One is how to assess it. So it depends on what you've got within your medical kit that you can use for smell. It doesn't have to be something specific, preferably something they can identify. So if I walk up and I say, please close your eyes, I want you to tell me what you smell. It smells good. Okay, so it's a good smell. Great. I didn't put skunk in front of her. According to whatever company makes Mr. Sketch watercolor markers, this looks like, I don't know, they have watermelons, cherries, and apples on here, so I have no idea.
Can I take a hit?
How about that one? Can you tell me what that smells like?
Dang.
Dude, I said smell it, not sniff it.
Blueberry-ish? Is that? What is that?
So it helps if you have something you identify. Rubbing alcohol works well, bleach
Smells like
works well.
Look, there's Brad outside. He's creeping on you.
So Brad might be coming here in a minute now. It's just ignore him because we don't need to know that he's actually here. So he's taking pictures because we're all dressed prettily today.
Oh, what?
Well, it's a good thing I decided to make
So you want pictures, like, do you want this up there or do you even care?
Just,
Alright, so
just cover my
what we're looking at is smell. Take something that they can identify. Ammonia caps. Ammonia caps are quick, simple, and easy to keep within your medical kits. Alcohol swabs. You can use alcohol cleansing pads. Just tear it open. They can smell. Most people can identify that. Smelling markers work fine. It's just hard to identify what the smell is outside of smells good or Fernando's version. Smells good. So,
Oh my God.
regardless, what we want to do is be able to acknowledge that they can perceive that smell. There's a new research that just came out, which is really pretty cool, that they're actually tying a very early onset detection diagnosis for Alzheimer's on smell. So they're actually test running, because I guess one of the first senses you lose, one of the first damaging areas that you have is to your sense of smell. So they go in and they're taking peanut butter on a stick and having people just smell peanut butter. And in your older age, if you're losing that ability to identify that peanut butter is there, then it's indicative that you may have early onset Alzheimer's, which is a really interesting way to kind of assess for dementia is through peanut butter. So again, your cribriform plate, you've got the bulb coming out, lots of little finger-like projections, and it's and depending upon who you believe and what you believe, it's based upon really the vibration of those molecules that you're smelling and inhaling that trigger your brain to acknowledge what that smell is. So what we have here, this little side shot, is the bottom of the brain if you're looking at it from underneath. And so we've ordered our cranial nerves by where they are located. So you have 1, 2, 3, 4, and that's how we get the numbers. It's based on their position coming from the front to the back of the brain. So, next one. Cranial nerve 2 is optic. So this is just straight vision. It's not ocular motor. So this is a somatosensory as well for the components. Location is coming out of the retina. Cranial exit is optic canal. And what we want to do for this is identify their ability to see. But we want to identify this unilaterally because, again, we have a stereo focus with our eyes. So when you're assessing this, we're looking for both straight vision as well as peripheral. So you can use something as simple as a card that would cover an eye. Take your hand from the side. When can you see it? Bringing it around, as well as you want to show focus to where you have letters on a wall. Can you stand here, read the word storage, and you have those cool little assessments of your 20/20 vision that you take throughout your life.
Is it better to use a cup?
Can you give us like little things to use to test?
For these things, there will be tools on your little. You don't need to show up with all your own smellies. I'm afraid of what Fernando would show up. So assessment for smell. You want their eyes closed. You put something in front of them that they can smell. You have them identify it. For vision, for cranial nerve number 2, for optic, check each eye individually. You want to check peripheral vision as well as direct vision, and have something preferably at the distance that they can then read or recognize shape, form. There are also those visual tests that are like the letter E, but they've rotated different ways. Which way does it open up? And they use those when and there's a concern about literacy populations, because if you don't, not everybody on the planet knows the letters. And so if we can do something simple like which way does the U open up, then we can get through without having to worry about whether they can read the letters. Oculomotor, so 3, 4, and 6. 3, 4, and 6 you're going to group together for visual motor. So, main actions, constricts pupil and accommodates lens for oculomotor. So if I take a pen light and you shine it in their eye, it should constrict. Have them look at the light, it should constrict down. So again, there'll be a pen light in there. So that one's pretty simple. Trochlear nerve turns eye infralaterally, so inferior and lateral, so down and out. And then I'm going to skip forward to 6 because that's abducens. That laterally moves the eyeball. Oculomotor, I'm going to go back because that part of that was missing. There we go. That's what I was missing. So oculomotor also moves the eye superior, inferior, and medially. So cranial nerve 3 goes up, down, and in. Cranial nerve 4, trochlear, goes down and out. And then cranial nerve 6 is abducens, which is abduct. It pulls it laterally. So how do you assess for those? Quite simply, look at me, don't move your head, follow my fingers.
In the name of the Father, Son, Holy Spirit.
And you're done. So we're looking at up, down, left, and right. We've got the capacity to assess their motions. And then we want the visual acuity for optic nerve with covering an eye and having them read or assessing peripheral motion. And then oculomotor is also pupil constriction coming from a pen light. So that's oculomotor, trochlear, and abducent, which is here. You can see that lovely picture where she's kind of going cross-eyed because one's not working. So if your abducent isn't working, then that eye just kind of shifts inward. Depends on what kind of damage is done. So, fun story, right? This is always good. So, I worked a professional women's football team. And if you ever get the chance, I strongly recommend it because it's such a unique experience and those people just want to play and they love having any kind of medical help around. So, third to the last play of the game, I've got one of my strongest linemen. She gets hit. She's not doing very well, but she doesn't want to show it, so she finds a way to play the next 2 plays. The game ends. Everybody gets done. They go in the locker room. They come out. Some of her teammates come out, and they're like, you need to go. She was our kicker as well, so they called her soccer. So they're like, you need to go check on soccer. And I'm like, I'm not going to the women's locker room at this point. I'm like, what's going on? No, you need to go. So I'm walking in there. Everybody's, where they need to be. So, okay, so I come in, and she's sitting up, and she's sitting on a bench, and like with her head reclined back against the locker like this. Like, so what's going on? How you feeling? I'm fine. I'm like, okay, that's a good answer. That's really a way to convince me. So what I'd like you to do is I'd like you to open your eyes and look at me and tell me that again. And she's like, I can't. I'm like, you can't what? She's like, I can't open my eyes. So if there's any time that you look back in your life and you wish you could have changed something, this is that moment for me. That moment that I wish I had a camera. Because if I could have recorded the next 10 minutes of this, it would have been freaking amazing for like teaching forever. So she's sitting there and she's like, I can't. And I'm like, okay, so if you can't open your eyes, that's just bought you a direct ticket to the hospital. I'm just going to let you know. So this is where language comes out. And she's like, I'm not going to the hospital. Well, that's fine, but if you can't open your eyes and there's something going on that's a little bit out of my scope of practice, so I'm at least calling the ambulance and you can tell them to F off. So she's like, all right, hold on. Give me 5 minutes and I'll fix it. So you asked, right? So can you fix cranial nerve damage? So the most amazing thing, she would sit there. She's concussed as hell. She remembers none of this. The day after, the next day, any of it. She remembers none of it. And so there's the thought processing is not quite there. But she would sit there, and as stubborn as she is, she kind of lift her head off the lockers, and she'd fight and see her eyelids like twitch. And then you could see that her eyes were rolled in and up, like they were stuck up that direction.
Oh my God.
And so, like, you could see, like, her fight to get control and focus off one, and then she'd get frustrated and she'd stop for a second. Then she'd start again, and she'd open her eyes, and she'd, like, and sure enough, like 5 minutes later, she could hold focus.